Kim. I've already washed my hands. Reasons someone may get an EKG is due to palpitations, arrhythmias, angina, atrial fibrillation, bradycardia, or tachycardia. The purpose of an EKG is to obtain a reading of electrical activity of the heart. You want to start in a quiet, warm, comfortable room, away from electrical equipment because that may cause an artifact. Other artifacts include somatic, which could be the patient shivering, wandering baseline due to lotion or oils on the skin, or interrupted baseline could be due to a misplaced wire. Okay, so this is John Hansen. I'm gonna obtain some information. Okay, he is 25 years old. Okay.
So first we would like to start placing the lead wires and the electrodes on Mr. Hansen's body here. The only one that won't be placed, however, is the right leg sensor or electrode. Either name is acceptable.
The equipment needed for an EKG is the EKG paper, which is wax or plastic coated, and it's heat and pressure sensitive. Because skin is a poor conductor of electricity, we use electrolyte substances to pick up the electrical current. Sensors and electrodes are used to detect the electrical current. And we relay them through the lead wires in the EKG machine.
So someone will
Start
be
by
placed.
placing these electrodes. Okay.
And the ones that would go in the chest region, these are called precordial leads.
Okay, so V1 goes at the 4th intercostal space at the right margin of the sternum. V2 is at the 4th intercostal space at the left margin of the sternum. And then V4 is the 5th intercostal space. And V3 is midway between V2 and V4.
V5 is at the horizontal line of position 4 at left anterior axillary line. And V6 is at the horizontal level of position 4 at left mid-axillary line.
Okay. You gotta put some at the legs. Okay. Go to the arms and legs. So the patient should look like this, the lead wires. Then you go over to your machine, and after you enter in the information, you print out the paper. And medical assistants only perform an EKG, but they do not interpret it.
The first chamber affected by the electrical discharge would be the atria. From there, the electrical impulses travel along the conduction system toward the ventricles to the AV node. From there, the electrical impulses are transmitted towards the bundle of His. The bundle of His divides the right and left bundle branches that continue to spread the electrical impulses onto the Purkinje fibers. The Purkinje fibers disperse the impulses to the right and left ventricles, causing them to contract. The P wave is a negative wave, and it represents atrial depolarization or systole. That's the contraction phase. The T wave would be a positive wave, and it represents ventricular repolarization or diastole. Q, R, and S waves could be a negative deflectional wave or a positive deflectional wave, and a negative wave as well. These represent ventricular contraction of systole. An electrocardiogram paper measurements allow professionals to determine time and voltage of a heartbeat. The small square is 1 millimeter wide and 1 millimeter high. One small square equals 0.04 seconds. The large square consists of 25 small squares and measures 5 millimeters wide and 5 millimeters high. One large square equals 0.04 seconds times 5, or 0.2 seconds. Each complete cardiac cycle takes about 0.8 seconds. The calculation of the heart activity is taken on EKG paper. For example, one small square, which is 1 millimeter, equals 0.04 seconds. One large square, 5 millimeters, equals 0.04 times 5, which equals 0.2 seconds. You would divide by 60 seconds, which is 1 millimeter, by 0.2 seconds. Another example would be, there are 3 large squares between our two waves. 300 divided by 3 equals 100. The heart rate is 100 beats per minute. EKG paper, which the reading is recorded on, is usually wax paper with white or pink background and color lines. An electrolyte, substance is applied with each electrode to pick up electrical current. Sensors or an electrode are made of metal or conductive material to measure electrical impulses throughout the body. Lead wires, as we all know, complete the circuit from the patient to the machine, and the electrocardiograph machine measures the electrical activity of the heart.